Welcome back to Interviews That Matter. I'm your host Raj Mehta. We are having a good conversation with Dr. Politi. Dr. Politi is the CEO of Nassau Healthcare Center. Welcome back, sir.
Thank you, Doctor.
So, Dr. Politi, you have made a tremendous and remarkable difference in the hospital, at the Nassau County Hospital. So congratulations for that first, in a short time. So I really want to congratulate you for that. And I've been hearing all these things, I already mentioned before, but I do hear about your, the way you do things, which is really, to make patient better, feel better. So appreciate it very much. So let me ask you this question. Why would a patient or a patient's guardian or whoever it is that choose one hospital versus the other? And why Nassau Healthcare is now better than other hospitals like LIJ or something like that?
Well, all hospitals in Nassau County, we're very blessed. We have a lot of very good hospitals, a lot of excellent physicians, a lot of resources here in Nassau County that you can't find anywhere else in the country or the world. So we are blessed here in Nassau by having some of the finest hospitals, institutions. The Nassau University Medical Center was always known as the county hospital, and that was always looked at as a hospital for patients that didn't have insurance or, God forbid, had a car accident. And so it had a reputation like that over the years. And during sometimes financially hard times, sometimes areas of the hospitals were neglected. And so patients tended to go to what was new and what was modern and who built the newest wing. And advertising is marketing. What kind of marketing is out there? Physicians in the community also affiliated with different hospitals and would like their patients to go to various hospitals that they're affiliated with. So what we're doing now at NUMC is changing that, and we're painting and cleaning and modernizing and upgrading so that the actual physical plant is on par with any hospital, and that when patients come in and they sit in a room and they look around, it's to their standards. And so we're making the physical plant as appealing as possible. We have the finest physicians, we have great doctors and great equipment. We just need now to get the word out to to the communities, to the physicians. We're trying to recruit physicians to join our hospital on hospital staff. So we're looking at the community physicians that haven't already dedicated themselves to one hospital to the next, that they could come and join our medical staff and bring their patients in. See, different priorities change over time, and at times the hospital focused on different areas. Maybe it was on government funding, whether it's a HEAL grant or a Vital Access Provider grant, and they gave money from federal government and state government to help us provide for some of the underserved populations. And we're still doing that. We're still providing for the underserved. A good portion of our patients are Medicaid patients. So we really look at those patients, a significant number of patients, and try to do everything we can to help those patients. So there are federal and state money that's available. There's something now called DSRIP, D-S-R-I-P, stands for the Delivery System Reform Incentive Payment Program, and that's money from the federal government, from CMS to the state, and that is to give to safety net hospitals. And in Long Island, Long Island Jewish is a safety net hospital, North Shore Long Island Jewish. The Catholic Health System, Mercy Hospital in San Francis and St. Joe's are also considered a health safety net hospital. And UMC, we're a public safety net hospital. So those are the three safety net hospitals right now in Nassau County. And that money is available to us to help work with patients and to basically change the whole thought of healthcare from being something of sick care to well care, something from a volume-based type of system to a value-based system, so that no longer you paid for how many patients you see and bringing volume in, but more how much value you bring to the table and how well you keep patients healthy. And that goes back to the preventive medicine and our FQHCs and our primary care doctors, that we get patients and we treat them sooner than later, and so we stop them from developing heart failure or having their sugar go out of control or the blood pressure too high, and then by doing that, you prevent their admission to the hospital by keeping them healthy. So there's so many things going on with that, and it could be simple like stop smoking and alcohol and wearing a seatbelt while you're driving, and different things for with children to make sure that they're aware of crossing at the green not in between, and all these other things that we try to teach our children to prevent them from having to be hospitalized. So there are a lot of mechanisms to do that, and there's funds for us to do that through some of these VAP-HEAL and district monies that are becoming available, and that's something we're not discounting, and we're welcoming that, and we appreciate all the help. We're getting really great help from some of our senators and assemblymen here in Nassau County, right up to the governor, that are really helping Nassau County, care for some of the uninsured and underinsured patients that do live in Nassau. See, people think of Nassau as a very affluent community, that there's lots of rich and wealth, and yes, there is in certain areas in Nassau County, but we still have areas of patients that are in need of health care, some patients that in need of insurance, and under the ACA, American, the Affordable Care Act, that is termed Obamacare, that'll get more, allow more of the uninsured to receive insurance, but there's still the undocumented patients that that are not available for insurance under the ACA, that we still need to care for, because they are people and they become sick, and we need to stop them from getting sick and help them before they come to the hospital. And when they do come to the hospital, provide them with the care that they need. And so that's the role of all safety net. I mean, all hospitals provide that care.
Yeah, ACA actually is applicable to every hospital, correct?
Yes, correct. It's a federal program.
It's a federal program.
Affordable Care Act basically is providing insurance to some extent, Medicaid type insurance to patients, so that they have some insurance. I mean, there's a lot of issues with that, and that could be a whole nother show. We talk about deductibles that are associated with that, and some of the other things that we need to work on and to overcome, but it's a start. It's a start to get patients into the system, because the sooner we get them in and we start to treat them for any of these comorbid conditions, the better we are in the long run, and preventing them from having catastrophic illnesses like heart attacks and strokes and cancers that have grown to the point where we can't intercede and correct those issues. So we've been out there. We've been doing a lot, as you mentioned. We've been receiving some great awards. We talked about gynecology and obstetrics, that new OB/GYN area that we have, and the new primary care. But we just received a 5-star rating from a nationally known group for our GYN surgery, and we received it for 3 years in a row. Only hospital in Nassau County to receive that. Okay. So that's a really great accolades for our doctors and our surgeons. Things that our OB/GYN services provide to our patients are being recognized. We received an A from Leapfrog, a nationwide hospital rating group. Leapfrog, an A for patient safety, and when I mean patient safety, I don't mean crossing the street or walking down the steps. We're talking about IV line infections and urinary tract infections and many other issues that might hamper a person's getting better quicker in a hospital. And all of these parameters and all these benchmarks and milestones, when you look at the numbers, that we're meeting them and we're exceeding what was expected of a hospital. And so we're receiving all these different types of awards quite frequently. I mentioned the American Heart Association for heart failure and for stroke as well. So we're constantly striving to do better. We're a level 1 trauma center, and so level 1 is the highest level of trauma centers you could be, and we have all the backroom stuff to support that, and that works great. One of the things we can talk about is other services such as orthopedics. You would assume since we're level 1, we have a lot of orthopedics, and we have a great orthopedic group in the hospital that works within the hospital with the surgeons and some of the finest orthopedic physicians for any type of spinal surgeries or back surgeries or fractures. We're right there. They're in the hospital. They're ready to go. We just hired a new neurosurgeon, a young female doctor from, she had her undergraduate she did college in Harvard. She went to medical school in Columbia. She did a residency in Columbia. Then she went out to the Swiss Institute in Seattle for her fellowship. Oh, wow. Okay. And now she's our full-time neurosurgeon. Wow. It's amazing, and we're so happy to have her on board and to add to our list of physicians. And people don't realize these are the quality doctors that we have there. And after that, we have, and we're actually on the 9th floor building a whole new wing for orthopedic and spinal care. So there's going to be a beautiful wing that's going to be dedicated with its own nurses station and beautiful floors and walls and lots of light coming in for orthopedic patients and for patients that have spinal surgery or any types of injuries. And one thing we have that's really fantastic, another thing we have that's really fantastic is our physical medicine and rehabilitation. We have a whole floor, the 5th floor, dedicated to physical medicine and rehabilitation. And what that is that after you have your stroke or you have your fracture or whatever you have, we admit you to this floor, and the floor is amazing. We have physical therapists, occupational therapists, speech therapists, all specialists to help you get back on your feet. Matter of fact, on the floor itself, we actually have a mock home, which has a bedroom and kitchen and laundry room, because we take things for granted, like making a cup of coffee from an automatic coffee machine. And yet, if you had a stroke, you may have a difficulty doing that. So we have a coffee maker, and you have to put the coffee in it to make your coffee. We have a washer and a dryer, so that we can help you to do laundry when you get home, help you make your bed, or even just set your alarm clock, or do things like this. So we actually have it looks like a small 1-bedroom house on the 5th floor that has all these things in it, vacuum cleaners and ironing boards and things along those lines. We have another room there that's set up as a store, like a supermarket, and with the shelves to help you reach to get stuff and teach you how to use some assisting devices so you don't overextend yourself trying to get some devices. ATM machines, you know how to, and these are things we take for granted because, we have lower arms and our legs and we can move everything perfectly. But if you've had some sort of trauma or you've had a stroke, you may need to relearn these types of things. So our physical medicine rehabilitation center is so well known is that the other hospitals in the area are actually sending their patients to us for several weeks to go through this rehabilitation. And that's our inpatient. And down on our ground floor, we have a very large outpatient physical medicine rehabilitation. Again, coming off Hempstead Turnpike, just drive down to the lower level, stop your car, walk in. You have full service physical therapy downstairs as well.
Wow, I think you're taking care of a lot of small little things, which is very important for anybody, psychologically. Because I think, when a patient comes in, they want to feel like, they want to feel good,
Yes.
I mean, half of the problem is psychological problem, right? So once they feel good, then I think, it makes a big difference. So really taking care of that aspect of it. And another thing they look for is the speed of caring, speed of, like doctor saying, doctor and all that. So I'm sure that you have done that also in ER, how long people have to wait and all that.
Yep, we have increased our emergency department throughput time. Basically, at one time, patients were being boarded in the ER for long periods of time, where you would be in the ER waiting for a bed. Well, we opened up additional rooms, additional beds, and have additional nurses, so that basically we don't have any boarding problem at all. We're probably one of the few hospitals that can actually say that once we put through the admission in the emergency room, that there's a bed either ready or being made ready available for you to go upstairs. So you don't have to spend a lot of time in the emergency room. And what that does is it makes more beds in the emergency room available for more patients to come into to be seen by the physician. We've virtually almost eliminated the waiting room where patients come into the ER when you walk through the main entrance. There's a greeter, and you tell the greeter what's wrong, and you'll be immediately sent either to a fast track area for colds and flus, and sort of like an urgent care center that's in the hospital itself. Or if it's something more serious, sent right back to the main ER, will be put into a room. Now, in the new rooms, believe it or not, in our ER, are all individual private rooms, and they're not curtained, they're actually walled off rooms with sinks, and they each have television. So not only do you have your own room, you have your own television if you have to wait. And most people aren't in the mood to watch TV in the emergency room, but it's there. Just to give you an idea of the level of comfort that's in that emergency department. And our fast track area is sort of like an urgent care that you see developing all around these small urgent care places. But the difference between us and urgent care is you're in the hospital, and if you do need a specialist, we have them. If you need an MRI, we have them, or a CAT scan, it's available. So if you go to an urgent care center, these might not be available. You may only have an emergency room doc there for you, but here we will have an endocrinologist, we have an allergist, we have a neurosurgeon that's available to come down and to take care of you. And if God forbid it's something more severe, we could admit you to the hospital or the EKG or the chest pain that you feel is really something, we can take care of that at the hospital with medication that they may not have in these urgent care centers. So they have their place in the community for various reasons, but when someone's really sick, there's no substitute for the hospital.
Right.
So we all have a very rapid throughput out of our ER, very quick, time to be seen by the physician.
Right.
As such, we have a very, very small leave without seeing number. We watch everyone who comes in to see how long they wait and basically their patient satisfaction at the end. We've been doing pretty good, and there was always room to improve.
Right.
But we have a great ER crew that's tries to stay on top of these things. With our new primary care center, hopefully we'll be expanding services to get more primary care hours available for patients that want to come in. Again, I think I said the number before was 476 NUMC, 476 NUMC. Yeah, so and so that's available, for patients that want to come in for routine care as well.
So all this, doctor, all of this equipment and all these improvements in the hospital building, that all takes money. How do you manage your finances?
Well,
Because the
finances-
hospital has to, it doesn't need to make money, but at least it has to be, par, at par, not in red.
It's true. And it's tough because of the populations that we do have that we do serve,
Yeah.
where Medicaid patients, the
Right.
amount that you receive really doesn't cover the bill, as well as the uninsured. We have about 25% of patients uninsured, so it's
Right.
very, very difficult
Exactly.
to break even, making money when you're treating patients as a safety net hospital, and we welcome those patients. We want those patients. We are that hospital to take care of all patients, no matter if they can pay or they can't pay. It does not matter to us. We want you to come to our hospital for treatment. And so we have to look at different ways of doing this, and that is bringing in specialists such as our neurosurgeon, subspecialties in cardiology such as our cardiac cath labs, doing more endoscopy and more procedures that are really truly needed by the communities, but they're not receiving them as far as preventive medicine. So there are monies available, there are grants out there, and we do look for different grants when they do become available, and we certainly need them. But you need to look at hospital as a business as well, and try to grow those services that the patients need,
Right.
and market it. And when they do come, give them a positive experience, because you'll have 100 patients that have a great experience. You'll never hear from them. But one patient, for some reason, doesn't have a good experience,
Good.
and you'll hear from them. And so we have to work to make sure we don't even have, not even that one patient that doesn't have. And that's a pretty lofty goal in any industry, particularly healthcare,
Right.
when unfortunately you do have, people that are sick and that do have bad outcomes based on their disease, not even anything that we could control.
Right.
And so there's always that feeling that, we in the hospital could do more, but sometimes in certain diseases you just can't, and you do as much as you can.
Viewers of our show is all from South Asia, okay, and I know you have got many doctors from South Asia.
Yes.
In your hospital, and we have a huge amount of healthcare practitioners in the South, our community.
Sure.
So tell us about what do you do for the communities? Like, you mentioned before there are various different communities that you go out, reach out to them. And
Sure.
tell us about that.
Yeah, we're in a very ethnic diverse area,
Right.
and we try to appeal to all different communities. And so we'll go out to different church groups, different synagogues, different mosques, and talk to people and sort of explain to them what we have and how we could be receptive to their particular needs, because everyone has their own particular needs. And so in the Southeast Asian community, maybe that means certain types of meals, certain types of prayer time set aside on Friday afternoon, which we do, and provide mats, and just try to appeal to different populations. We do have a lot of Southeast Asian employees at the hospital, and a lot of physicians, nurses, pharmacy department, just about everywhere you go in that hospital. And so I look to them to help me. We have a language interpreter on service, When you walk into the main lobby, there's a door, a beautiful office, there's language services on it,
Mhm.
that we can have someone who speaks various dialects and languages that make people feel comfortable.
Mhm.
Because one of the hardest things in medicine is trying to translate to someone that doesn't speak the same language as to what is wrong with them, what we're doing,
Right.
and it's a frightening experience to begin with.
Right.
And then if you can't explain to someone what you're doing, or to understand, so they understand what's wrong with them, or that they're going to be better, or that we're going to help them,
Right.
it makes it worse. So
Right.
we have that services, we have those services in the hospital for different languages to be available 24 hours a day,
Mhm.
7 days a week, to talk to people and calm them down and to explain to them exactly what's going on. And then we try to look at people's different, uniquenesses, and whatever it might be, whether, it's in the South Asian community, the Latin community, the African American community, and we try to appeal to them to work together to make them feel comfortable while they're in the hospital.
Good, I think, that does it for our show today, actually. We definitely want to have you come again here in some future dates.
Sure.
Yeah, so I appreciate your time, really.
Well, thank you very much for having me and giving me the opportunity to just talk a little bit about NUMC, Nassau University Medical Center, and to get the word out that we really are improving daily, getting better, and that we would like for everyone to take a second look and come back. And you'll really be surprised from the second you walk in that door of how nice, how clean, and how modern, and just about the care that you're going to receive there at Nassau University Medical Center.
Well, I definitely want to congratulate you on in short time. You've done a lot, so we want to wish you all the best,
Thank you,
for
sir.
future. And whoever comes over there, treat them, make them better, and that is the best reference you can ever have
Thank you.
for a hospital, for any business, rather.
That's true.
Yep,
We'll do the best we
right.
can.
So, thank you for joining us today. If you have any questions, comments, you can email me at rajamitv@gmail.com. That's again rajamitv@gmail.com. You can watch our prior shows on YouTube at youtube.com/Infosys International. That's again youtube.com/Infosys International. Until next time, have a great week.